This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Amanda says, how can you treat adenomyosis? Can this also cause poor quality eggs? And then a follow-up one is, and can adenomyosis cause early recurrent miscarriages?
In terms of egg quality, it probably doesn't make any difference unless the adenomyosis is also associated with endometriosis. And there is an association of egg quality with patients with endometriosis.
The next one, Prof, from Dusika is there much difference between IVF injections between Victoria and New South Wales?
The injections? None. They're pretty universal the world over. What drugs are available in Australia are Australia, not state by state. We do differ in terms of our regulations, that's for sure, but that's nothing to do with the injections.
Question from Amy Elizabeth. How long do you recommend using progesterone pessaries, particularly for women with secondary infertility?
I use progesterone pessaries associated with I'm doing treatment cycles like IVF. And if someone's pregnant, if their progesterone levels are good, I stop the progesterone. There's no evidence of carrying on. In relation to treating infertility with women with normal cycles, then all you're doing is giving progesterone to top up what nature normally should be providing. It's rare that I do. The times that I would use them in that situation would be if the woman ovulates on day 14 but has a period only 10 days later or 8 days later. So she's got what's called a short luteal phase. And using progesterone in that scenario may be helpful, although randomized studies really don't exist to prove that one way or the other. But it makes some sense. And certainly when I do that for women, the cycle lengthens and pregnancies do occur. In terms of carrying on after a pregnancy starts, I don't think there's much evidence to support it.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.